Hi, my name is Gabrielle Andrews, and today I'm discussing intermittent versus indwelling urinary catheterization for those who require long-term catheters. Catheter-associated urinary tract infections, or CAUTI, has always been a common recurring issue in those using long-term and short-term catheters. I believe this complication is very preventable, and when it is prevented, there's a lot more benefits and positive outcomes for the community and the patients. Resolving the issue I previously stated is important for many reasons. For me, it's important because as a future nurse, I want the best possible outcomes and quality of life for all individuals receiving any type of medical attention. It's important for the public or those who are caregivers for individuals with long-term catheterization because if they develop CAUTI, those caregivers tend to develop additional stress and neural strain because they now have to treat the infection as well as continue their caregiver duties. It's important for the patients because quality of life is an important priority when providing any type of care. Therefore, intermittent catheterization does not restrict individuals with their daily activities as much as indwelling urinary catheterization does, which may provide more independence. Along with this, if CAUTI is developed, individuals are likely to demonstrate symptoms such as pain, discomfort, confusion, and many more. Therefore, if intermittent catheterization is used, developing a sense of independence and remaining free of infection will increase the individual's quality of life. And then, last, it's important for the healthcare systems, because when a patient develops CAUTI in the hospital, healthcare systems then have to provide additional medical care, resulting in higher economic costs to provide treatment. And over time, these costs will accumulate, resulting in a great amount of money contributed to CAUTI from the healthcare system, which can then lead to further economic issues. Therefore, this then brings me to my statement. For patients who require urinary catheterization for more than 28 days, does intermittent catheterization compared to indwelling urinary catheterization impact the number of CAUTI cases over a 12-month period? The first database I used to find two of my articles was CINAHL. For my filters, I used full text in English, and then for my first source, I used the search terms CAUTI or catheter-associated urinary tract infections and costs and studies, which brought me to 116 results where I found one of them to be useful for my project. For my second source, I used the search terms long-term and indwelling urinary catheter and studies, which brought me to 71 results. I used both of these articles because I found them to relate to my topic. The other database I used was Medline, where I found my three other articles. I used the same filters again, which were full text and English, and my goal for this was to find an article based on which type of catheter patients prefer. So I used the search terms patient preference in indwelling urinary catheters or intermittent catheters, which brought me to 968 results, and I used two of those articles that I found in that search. And then for my last search, I used the terms intermittent urinary catheters and long-term and management or quality, which gave me 30,043 results. And then I used these articles because I found them also to be appropriate for my topic and useful for information. All the articles that I found supported my topic by either providing information on the complications with indwelling catheters or the benefits of intermittent catheters. In my first article, I found that CAUTI increases the economic cost of healthcare systems. In the second article, a 6-month study including participants with long-term indwelling catheters was done, and CAUTI occurred in 70% of those participants. In the third article, it was found that being able to self-catheterize provides individuals with more of an acceptance of their condition, which I believe that allows them to have more self-independence and quality of life. In the fifth article, individuals who require catheterization state that they value convenience, ease of insertion, and reduced risk of infection. Therefore, more of those individuals said that they were willing to pay the cost of intermittent catheters. And then in the fifth article, women who had urethral stricture were informed on intermittent catheterization to prevent the reoccurrence of the stricture happening again. And according to the study, there was no reported reoccurring cases in those who were compliant with their intermittent catheterization. I did not find any inconsistencies between these articles. They all provided information to support my idea of intermittent rather than indwelling catheterization. In the first article, variables such as age, gender, mobility, and others are suggested to reflect on their adherence. However, there's a lack of studies to clearly support which variables reflect on their adherence for self-catheterization. And then in the second article, the study population included ICU and non-ICU patients, pediatric and adult patients, inpatient and outpatient individuals, as well as Medicare and non-Medicare patients. Therefore, this wide variety of patients made it difficult for reliable pooling of that data because these factors cause the cost of CAUTI to fluctuate tremendously. And then also in that same article, healthcare is constantly changing, so the estimated attributed costs of CAUTI are always changing as well. And then the third limitation from that article is increased hospital stay due to CAUTI is not included in the study. Therefore, the true total cost is underestimated because it'll cost more than what they claimed in those articles. And then in the third article, most of the participants used were current Coloplast catheter consumers. Therefore, this increases the risk for biased behavior towards the study. And then also, participants had no previous experience of paying for their intermittent self-catheters, which may cause biased results related to their willingness to pay. And then in the fourth article, there was a small sample size of only 7 women, and then the duration of the study varied between 6 months to 30 months, or 34 months for these women. So some women were studied longer than others, which can reflect on the data that was collected. And then in the fifth article, small sample size again of 43 participants, which made it difficult when combining data and forming conclusions. And then self-reported data was used, which increases the risk for underreported information, which results in limited data collection. The rate of infection is higher in those with indwelling rather than intermittent catheterization, which I believe that that's adequate evidence to support for having a practice change. According to the National Clinical Guidelines Center, where clinically appropriate intermittent catheterization should be used for urinary drainage rather than chronic indwelling catheter. Therefore, based on the studies that I have done, intermittent catheters rather than indwelling urinary catheterization provides individuals with less risk for infection and higher quality of life.